I'm Nancy. I'm the mayor's assistant, by the way.
Oh, cool. All I'm gonna do is, you'll just, are you able to take it off just to say 1, 2, 3, 4, 5, when you do it?
Okay.
So,
Yeah, because I don't know if they're going to be having their mask on or when they're
I
speaking.
just need just for this top. We just need to see your lips.
Okay.
If I could just have the speakers back here, any of our community members take a step back or come to the front.
It's over here.
You guys are going to be right here? Perfect.
By the big red.
By the big, oh my gosh, no way. I love it.
If you need us, we'll be here.
I know some of
Should I send it over?
It's kind of cloudy today. No.
Let me know when you're ready. Let me know when you're ready. Can you take it off, please, and now count to everybody?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay, so I've got my leadership team, some nurses down, so I'll be in my room or at the pool anyways. So, that's maybe not. Spread out.
Maybe one more. All you have to do is just stand where you think they'll be.
The speaker.
Yeah. Perfect. Thank you.
Morning. Thank you for joining us. We're going to start placing everybody. We're going to be in the press conference, so you can get our fire guys and get out, social distance.
Jeremy, Mikey. Rico, young buck. Hey, I'm not
Right here on the edge. Regulators.
It was self-defense. He punched me first. He's touching me.
Yeah, we can.
Another row?
Right here. Our speakers right here on the white spot here. On this little bridge. Spread out. Perfect.
Bobby, do you want to have another row?
Oh my gosh. Hello. This one is catching everything. Come on, maybe.
I know.
the truck, like, should we move the truck forward a little bit, or are we good?
It would be in the shot more,
Yeah?
but
Yeah, well, yeah, we can move it.
we're not allowed to say. If you want the truck to be in the wall, that's
Welcome. Nice to meet you.
Better? Yeah.
Yeah, it's good.
Yeah.
Keep looking at me.
Oh.
Great, thank you.
I'm at the MOC, but so I have the sector, the cities and government sector, the tribal nations, and the binational. Yeah. I thought I was busy before, but I'm busy now. Yeah.
All right, everybody. We need everybody to be spread out 6 feet. Seriously, 6 feet. Anybody who's not going to be in the shot needs to go off that way. We're going to get started. Here we go. Oh, hi, everybody. I'm Alejandra Noe here. Good to see you all. Hi.
Welcome. Thank you.
Thank you all for hosting Paradise Valley. Thank you. And we're ready to have a great time to talk to people about what the next phase is for our community, especially knowing that we have to have testing done to reopen our communities. All right, you guys ready? Yes. Oh my gosh, are you guys ready? Yes.
All right, that's what I'm talking about. Just remember, 6 feet, arm's distance, make sure we have that space. All right. And I think it's 9 o'clock, are we good? All right. Let me know when we're ready. Fine, I'll remove my mask for you guys. Make it a little easier. Ah! I can't move. I just took off my mask. Thank you.
Sorry, 1 second.
Yeah, not a problem.
Alejandra,
I'm
want to put the binder there to hold your pages?
I'm good. I'm just going to fold it. And thank you.
Or cell phone.
Too close, we could go out that way.
Good morning. Buenos días. Yeah.
They're hoping they can have an extra second.
Yeah. Thank you. Necessity is the mother of ingenuity. I love it.
How much they charge for that?
A lot. Thank you. Shell of love.
Yeah, we got some from you.
Yeah, and we could go all the way if we wanted to keep going out. As long as we have distance. Oh, okay. Yeah.
You can turn it off and on from here. Off and on.
Go ahead, test it.
Say again.
How do I say Nairobi's last name?
Last name Jadeja.
Deja. Good morning, everyone. How's everybody doing out there? All right. Well, we want to say thank you again to all of our first responders. Any nurses in the house? Woo! Yesterday was National Nurses Day. We want to again thank all of our healthcare professionals and personnel. We are holding for just one more minute. We're trying to get the TV cameras all linked in. We have one camera person here that is feeding all of the other TV stations. So that's why we're waiting. But we want to thank you all for being here this morning. Thank you to Paradise Valley Hospital for hosting us. Thank you to members of the public that are here joining us as well. And our partners who we will be in, or I will be introducing shortly. Do you want me to do it with the microphone or no?
I don't need it.
Okay.
So.
I'm not gonna use it. Do the other media outlets need me to use the microphone? Do you need me to use the microphone? Okay. All right. Let me know when. All right. Good morning, everyone, and thank you for joining us here for our T3 Plus press conference. My name is Alejandra Sotelo Solis, and I'm the mayor of the city of National City, spelled A-L-E-J-A-N-D-R-A, last name Sotelo, S-O-T-E-L-O-S-O-L-I-S. I'm joined by Kevin Matson, the CEO of San Ysidro Health, Nirav Jadeja, Chief Executive Officer from Paradise Valley Hospital, and thank you again for hosting us today. Also joined by Barbara Jimenez, Director of Central and South Regions, South County Health and Human Services, as well as Chief Frank Parra from the National City Fire Department, and many of our fire personnel. And lastly, the nurses and health professionals here from Paradise Valley Hospital. Go ahead and give a wave, everybody. There you go. So in National City, as of last night, May 12th, the county reported that we have 238 identified positive cases, which is 4.7% of the 5,161 cases countywide. However, with our population count, we are 382% above the 100,000 population rate. This puts National City with the highest percentage rate in the county. This is very concerning and allows us the opportunity to be proactive with traditional and outside of the box thinking with our response and our partners in addressing those growing numbers. We are proud to announce today that these collaborative efforts emphasize supporting the county's T3 efforts: testing, tracking, treatment, and an additional member, the plus sign. The plus means that even with the governor's stay-at-home orders, we need our communities to continue checking in with their primary care physicians, whether it be teleconference or video chat, to address those chronic or underlying health issues, including diabetes, health disease, and making sure they have their dialysis treatments. Again, this is all in order to continue to stay healthy to combat potentially the higher risk of contracting the disease. As we try to move into the next phase of opening up our economy, we must do so responsibly. This means we must work aggressively and ask for a plan to increase testing for COVID-19 to get a more clear idea of how far the disease has progressed in National City and help the county reach their daily goal of testing 5,200 people per day. As I've shared in the past, our community, National City, is a proud working class community that has multi-generation families that have roots here, that deserve the praise and attention they have been providing in this fight against COVID-19. As we celebrated our nurses yesterday, happy National Nurses Day. Yay, shout out to all our nurses that are here. In addition to the nurses, it is also important to recognize that many National City residents have also been deemed essential workers, who, again, over the last 2 months have been stocking the grocery stores, helping provide services in the healthcare and public safety community, and using mass transit to get to and from those jobs, in particular, the Blue Line. And for that, we say thank you. Gracias. Salamat. The San Diego County Health and Human Services Agency has been doing meticulous work with tracking and tracing of the disease as it's moved through our communities, and announced last week that they will expand the number of people doing this work. Again, as we try to move into the next phase of opening up our community, we must do so responsibly. Yesterday, the county performed 2,440 tests countywide. With that daily goal of administering 5,200 tests countywide, we are proud to announce today that we are focused on increasing the T3 plus efforts in National City. So what does that look like? The county has provided testing for 4 priority groups. The county is recommending several specific groups get priority for active infection testing. And again, those are based on federal and state recommendations. Healthcare providers with capacity to do so can always test beyond these priority groups. And here are the 4 priority groups. Priority group number 1 is hospitalized patient, healthcare workers with symptoms, close contact of people who are confirmed cases in high-risk settings such as long-term care facilities. The county has shared with us that our most vulnerable in our skilled nursing facilities, our SNFs, will be at the top of the list to be tested here in National City. Our skilled nursing facility elders will be taken care of. Priority group number 2, people with symptoms who are 65 years or older, have underlying medical conditions, work in essential health and public safety jobs. 2, people without symptoms who are entering group living sites such as long-term care facilities, homeless shelters, correctional facilities, or drug treatment programs. Those that are healthcare workers. And 3, people who people with or without symptoms in other vulnerable populations, including people experiencing homelessness, people with HIV/AIDS, those in rural areas, people who are non-white, non-Hispanic, and older adults. Priority group 3 includes other essential workers with symptoms, those essential workers without symptoms, and those especially during health investigations and other disease control activities that are in high-risk settings. And lastly, the 4th priority group is people with mild symptoms in communities with high number of COVID-19 infections. Surveillance testing of individuals without symptoms, and those surveillance testings of non-COVID-19 deaths. If you raised your hand, audience who is listening, those who are watching our recording, if you raised your hand for these priority groups, the question is, now how can we get tested? If these individuals are to contact their health care provider to discuss a course of action. If an individual does not have a physician to turn to, they can simply dial 211. If it's decided that testing is needed, they are free to seek testing at their medical home. which for many residents in National City means Paradise Valley Hospital, San Ysidro Health, or Samahan Health Clinic. To expand these efforts, we'd like to share the following. Last Thursday, we launched our free food distribution with the San Ysidro Health and Catholic Charities organizations at St. Anthony's Church. And today we're excited to share that in the near future, we will be offering free COVID-19 testing through that effort. Soon you will be able to make an appointment for emergency food and testing for you and your family members. Again, details are forthcoming, and CEO Matson will talk about our strengthening partnership with San Ysidro Health and the importance of the plus in our T3 efforts for folks to get medical care during this time. Secondly, we are hosted by Paradise Valley Hospital, who just last week received 2 rapid testing machines from the county for their admitted symptomatic patients. CEO Jadeja will share more about their efforts here at the hospital. And lastly, tracing is an essential element to limiting the spread of the disease. Central and South Regional Director Barbara Jimenez will share the promotora or community health worker model that will be implemented as part of the county's T3 efforts, as well as opportunities the City of National City will have to host various pop-up sites in the future through their mobile Live Well bus. Again, thank you to our partners who stand with us. Again, today, thank you all for being here. Thank you all who are here to stand with us against this battle against COVID-19 and for being proactive to serve the National City community and the South Bay region. And now I'd like to introduce Kevin Matson, CEO of San Ysidro Health Center.
Thank you, Mayor Solis. San Ysidro Health started doing symptomatic testing for our patients about 6 weeks ago, and we've been testing patients at our South Bay Family Health Center. We're averaging about 25 patients a day with 25% positive results. We're looking forward to our partnership with the county, the City of National City, Paradise Valley Hospital, as we move forward with testing on asymptomatic patients in National City and throughout the South Bay. We're also looking forward to our partnership with Catholic Charities and our other community-based organizations in our food distribution program in National City. One thing that I think is very important is that our patients, there's so much focus on COVID-19, we want to make sure that patients are taking care of their primary care issues. Many patients that we serve have comorbidities and conditions like diabetes, hypertension, cardiovascular disease, and they need to get their issues addressed. They should be calling their primary care physician and making sure that they're not losing control of the conditions that we've been managing for years. San Ysidro Health has San Ysidro Health line at 619-205-6792. You can call that number. You can talk to a physician about the conditions you're experiencing and make sure that we're addressing any issues. If you're symptomatic, we'll get you in for testing at a testing site for symptomatic patients. If you're asymptomatic, we will be coming out with new sites and moving mobile units throughout the South County to do testing for asymptomatic patients. Is there anything else I need to address, Mayor?
I think you covered it.
I covered everything. All right, thank you.
Thank you, Kevin. And now I'd like to introduce CEO of Paradise Valley Hospital, Nerav Jadeja.
Thank you, Mayor. We appreciate it, and we appreciate you choosing Paradise Valley for allowing us to host. First of all, I'd like to thank all of our healthcare heroes. This week is National Healthcare Week, and we have staff from EVS, nurses, physicians, lab technicians, and I'm gonna miss a number of other ones, but that are working every single day to take care of patients and provide a safe environment for the patients that we have that are fighting this illness and for the patients that don't. And I think it's extremely important to acknowledge them this week, especially during Healthcare Week, and and commend all their hard work and effort in providing patient care, because they are the true heroes here today. As for what we're doing from the hospital perspective, I would like to thank Mayor Sotel Solis and the county for providing us 2 point-of-care testing devices that are now able to test patients within 1 hour of coming in and getting their labs drawn. So we are able to test them timely, get results timely. It helps reduce the use of PPE gear so that we're able to conserve that, because that has been a national crisis for the last couple of months. Also alerts our staff on which patients are positive timely so that we can take care of them timely. As of today, we're only using these for patients that have the symptoms that meet the criteria. We hope to expand, working with the county to acquire more machines so that we can expand and test every single patient, as well as every single patient coming into our emergency room. One final thing I'd like to close with is the hospital is still a safe place. We do have positive patients, but we are taking every precaution we can to ensure the safety of anyone that visits the hospital. Now, we have limited visitation. We do have protective, personal protective equipment for everybody. We are doing a scrub exchange with staff so that the clothes that they bring in are not the ones they're leaving with, so that we can protect our staff. We have masks, and we're doing everything possible, including creating intubation boxes and transport gurneys, and announcing overhead when we're transporting patients so that no one is improperly impacted by a positive patient. So we've had a number of success stories that we'd love to share in the future, but as of now, we're working very hard to keep our patients safe. And if you're out there and you need health care, just know that the hospital, all hospitals are taking precautions to take care of their patients. Thank you.
Thank you, Naira. And now I'd like to introduce Barbara Jimenez, the Central and South Region Director of the County Health and Human Services Department.
Thank you, Mayor Sotelo Solis. So as we've heard earlier, the mayor speak about, all of our speakers really think about, the data demonstrates that our expansion of testing in the South region is critical. Our chairman, Greg Cox of the Board of Supervisors, has discussed the importance of expanding in the South region. As someone who gets to live, work, and play in the South Bay, I am excited to be here today to talk about and give an update on behalf of the County of San Diego and our lead for what we're calling the T3 program, Nick Machione, our HHSA director. So my focus is going to be specifically on the activities and strategies specifically here in the South Bay. T3, you've heard about, it stands for testing, tracing, and treating. It's all about coordination and delivery of the high levels of service as we respond to the threat of COVID-19 in our community. Our specifically and especially convened County Lab Test Task Force continues to meet regularly to really refine what a regionally coordinated, data-driven, equity-focused approach to testing would look like. We're committed to working with our community partners and very excited to be here today with these great partners to really address the equity among our vulnerable populations. So how are we doing that? First, you heard about testing. Testing is the first step. We must do more. The number of tests, as the mayor mentioned, is growing. We had 2,440 reported yesterday and over 80,000 since testing began. In the South region, we are partnering and excited to be here today with leaders such as Mayor Sotelo Solis, San Ysidro Health, Paradise Valley Hospital, and how to include our testing in innovative and creative ways, such as the food distribution efforts. Our County Public Health Lab, as you heard, has been collaborating very closely with Paradise Valley Hospital. Here in the South Bay, also at the old Sears building in Chula Vista, T3 has placed 2 of the 6 testing lanes that are dedicated to our county. These lanes can provide over 230 free tests per day. So I just want to remind everyone, you do need to schedule an appointment. It is free, and if you call 1-888-634-1010, 1123 or sign up at lhi.care/COVID testing, you can get an appointment. Please make sure to get an appointment. Don't show up without an appointment. And if you have an appointment, please make sure that you go there. But we do need to do more, and we'll be working with our partners to do that. Now, tracing, we continue to ramp up tracing, and that means ramping up our staffing. The county has expanded to 170 FTE resources, and we're working hard to make sure that we can get to our initial goal of goal tracers. For the staffing, we really are focusing on diversity. It's really important that we have multiple languages, and that we can expect to be setting that bar high among what tracing can look like. The mayor mentioned the promotoras. We are among the first, if not the only, to leverage the promotora model here in the county. The promotoras, or community health workers as they're also known, are for the community, by the community, and in the community. They know the community. They are trusted by the community. They are a critical piece of our tracing group. And finally, treatment. What does treatment look like? As the testing and the tracing increase, you're going to see that the numbers that we're caring for in our public health hotel rooms is growing larger. We have 195 individuals currently in isolation. So we are caring for our community together with all of our partners. We're continuing to do this, and we will continue to do this until this virus is defeated. We're excited to partner with Mayor Sotelo Solis and all of the South Bay leadership to continue to expand testing. And more importantly, it's about a coordinated strategy to reach our most vulnerable populations. Thank you.
So thank you again to all of our speakers here for joining me today. Let me do that one more time. Thank you again to all the speakers for joining us here today. And again, we want to remind our National City and South Bay neighbors that in order to address increasing numbers of positive COVID-19 tests, it really mandates an increase in testing, tracking, and treatment. It also requires an education period of what T3 is, testing, where and how to get tested for those with and without symptoms in our high-risk communities. The second T is tracing. As was shared by Director Jimenez, what is tracing and how will the promotoras and county healthcare workers continue to serve our community? Treatment. If you are positive, it's making sure that you have all the necessary resources, including food, water and shelter, and mental health check-ins on behalf of those healthcare workers. And the plus, as we mentioned, it means that even with the governor's stay-at-home orders, we need our communities to continue to check in with their primary care physicians for chronic or underlying health issues. National City is working diligently with our businesses, schools, and recreational community to open up in a responsible manner following the orders of the county and state. We must do so knowing that the coronavirus is among our communities, and we need to know how we can contain its spread, and more importantly, that it is our right to do so. Thank you, and now we will open to questions. Yes?
Just wondering, as far as the number of cases, can you identify how many are healthcare workers, and do they have the
I don't have that specific detail, how many are the healthcare workers, but do you guys have, so the question is, do we know how many of the positive 238 cases are healthcare workers?
And then if you could talk about the PPE also that you guys need here.
We've been working as part of the board as well as leadership here at the hospital. We are working to do a distribution with the nurses here on this weekend, again in celebration of her National Healthcare Week, and helping to address some of the needs for PPE. Other questions? Other questions?
A number of PPE, like N95s coming here, or what are the needs?
You know, we've been working with the county when it comes to all needs that our medical community needs. whether it be our public safety, fire, and PD, as well as our medical community. We've been working hand in glove with our county to request any PPE or medical supplies that our community needs. So we are providing, we're getting that information to our county partners. Yes. Question? Yeah. Yeah, I will do it in Spanish too.
Yeah, I don't understand too much what is new about today. Like, the amount of testing increased, if so, by how much? Like, they've had machines for 2 weeks, and
They got them last week. They just started testing yesterday.
so that's like,
Yes, theirs is new. Their testing process just started yesterday here at the hospital. But the reason we are doing this is our community is not aware of these efforts in its entirety, and we want to push that it is our right in National City and our South Bay communities to go get tested. Even if they do not have symptoms, they can ask their healthcare provider for the request to go get tested. But they can also do the walk-up testing in Chula Vista. It's that empowerment of our community that we want to make sure that the residents that are watching and engaging know that this is happening, and specifically in National City, those two efforts that we have with the food bank, as well as the various testing site that's happening in San Ysidro. We want to make sure that people feel empowered to ask for the test.
outside of here, currently, where else can people get tested in National City?
They can go to San Ysidro Health Center, again, to call the number. All of these agencies, you have to have an appointment. But it's San Ysidro Health. We have the Samahan Clinic that also offers testing. Again, you'd have to call their number. If you do not have a medical home, you can call 211 to make sure that, if there is another agency, they will feed you into that third option. And then the fourth one is the walk-up that's here in our South Bay community at the Sears facility in Chula Vista, right outside the boundaries of National City.
Are all testings free, or there's a cost to it?
Testing right now, if you want to, do you want to take the question?
So we're testing everyone if they meet the criteria to be tested. So we're not discriminating based on ability to pay or anything else. Some of the insurances will cover it, and the county is looking. We're working with the county to see if they can support us on any other ones as well. So, and
That the testing upstairs is free? So
Yes.
that's what
Yes.
yeah, and absolutely, we have plenty of PPE. I think that was your other question. The county's been a great partner with us in providing any shortages in supply chain, and so we've anytime there's been a shortage over the last couple of months, the state has gotten its allotment, and the state has passed it down to the county, and we've gotten it from the county. So they've been a great partner for us.
And then
So.
as far as healthcare workers, do you have a number on how many?
I don't have a number. It's a very, very low percentage. Most of the ones that we're seeing are coming in from the outside, so not acquiring it in the facility. So, yes.
Regarding testing here, like, how many tests have you done, and how many come out positive?
So we started testing on the new machines yesterday. I don't have the up-to-date numbers. It was a handful yesterday, and we're going to continue to be able to test. The machine has a capacity of doing, each test takes about 45 minutes to an hour to run. We have two machines, so we can do about 48 tests in a 24-hour period. And so as of today, we're going to continue. Now, it's also testing is based on the availability of reagents. We do have a supply of reagents currently, and we're looking to continue to get more as well.
And how big of a deal is it for the hospital to have those machines?
So it's very important. Prior to this, we were having to send our tests out, and the turnaround time could be anywhere from 24 to 48 or 72 hours to get a result back. During that time frame, we're going through a lot of the PPEs that we're having shortages on. So we no longer have shortages, partly because we're able to do the testing, and our burn rates aren't the same because we're not using PPE on patients that don't need it. So I think that's important to understand. So.
Any other questions?
For me,
An urgent care that was closed. We actually
Yeah,
have the.
it's-
Go ahead.
yeah. So we did close the urgent care. You know, with everything being locked down, seeing 3 to 5 patients per day. So after all of the country opens up, we're looking to enhance that. At the same time, we've enhanced our tele capability, so we're looking to grow our tele services, and so people can get telemedicine, so people can get their health care from home. So, thank you.
Yes. Thank you. Thank you, Nero.
With regards to the promotoras,
Uh-huh.
do they have to be one of the medical workers, or you also have volunteers involved?
That's a great question. So we have a question regarding the promotora. So I'll let Barbara come up. So what does the promotora model? Are you looking to hire? How does it does it work for the promotoras?
Yeah, we're really excited about the promotoras. As I mentioned, when we go out and start contacting people, we want to make sure that, the promotoras have already a trust built in within the community, so they would help us to easily access these families, get information. Families may feel more comfortable and speaking with someone who is in their community that speaks their language as well. And so between the folks that we're hiring and our promotoras working together. So we usually have an investigator that does the initial investigation, and then from there we're doing what they call the contact tracing, reaching anyone who may have had contact with that particular individual, and that's where we would leverage the promotoras. It's going to be a combination of being able to expand or tap into contracts, and then in addition using many of the promotoras or community health workers who are already doing the work, and this is part of their volunteer work or part of the work that they do for their agency. Does that answer the question? Yeah.
Really,
South Bay community specifically, kind of what are the unique challenges here? Obviously the numbers are concerning, but why do you think it's happening and what's unique to this area?
Okay. I would say that we have, again, mentioned that we have the essential workers. We have essential workers. We have folks who have not had time away. They've actually been the ones stocking the grocery stores, been the ones here at the medical support, and, really the ones on the front line. And so as we talk about the essential employees, we also have multi-generational homes where you may have an essential worker with grandma and little one and mom and dad in one household. So all of that, creates a very unique and challenging environment that ultimately when we want to combat the spread of the virus, it's really looking at these unique cases. And in National City, it's not necessarily unique. We can say that happens more often than not. So I'd just like to do a quick message in Espanol.
Hold on one second.
Okay? Yeah.